I always say to my families, I'm a resource. So my job, you're the parents, you're the most important decision maker in your child's life. And my job is to give you all the information that I have and my expertise. And then it's your job to decide what's best for your child. And I can only guide you. And there's no wrong answer because it's your child. When I was younger, my brother had severe headaches. We went to multiple doctors, and finally we were referred to a children's hospital and to a pediatric neurologist, and she became a big part of my life. She actually stayed a mentor and helped me, and I rotated with her even during my medical school days. And during the residency, I decided to specialize in pediatric epilepsy, and that became my one great passion. In pediatric epilepsy, we have made great strides. There's been a tremendous amount of research. There have been more new medications over the past few years than there ever were before. We have surgical interventions that were not possibilities, including the resective surgeries. In addition to that, we have devices and implantable things and just options for those patients that didn't really fit into any of those specific categories. And there's constant gains in the field with research studies, and we're part of it here, looking at these children that are continuing to have seizures and not responding. We're continuing to study them to see not only can we treat their seizures, but can we help prevent others from having seizures in the future. Pediatric epilepsy is a team approach. It's not just the epileptologist, it's having a neuropsychologist, it's having the options for surgery. So you need a pediatric surgeon, you need the social worker, you need all of that team to help you manage that, the school teachers. And basically the approach is, you know that there's a risk. So we know that children with epilepsy can have learning issues. We know they can have attention issues. We know they can have behavior issues. By making sure families are aware to look for them, it helps us find these things sooner. And by finding something sooner or earlier, we're able to make more of an effect and help reduce some of the burden that the families are facing. Everyone has to feel comfortable with their doctor. It's the most important part. I treat every patient like I would want my family member treated, and that's always my goal, and I think that families appreciate that, and I think it helps whether they continue to have seizures, whether I can make a difference in that. And I always tell them, I may not be able to make your child seizure-free, but my goal is to make this as easy for you as possible and give you all the possible information you have, and make sure if you have any questions that I address them. Whether your child has a diagnosis of epilepsy or possibly has seizures and you're not sure if that's your diagnosis, it's a very scary thing. And I think one of the things that we excel at here is making sure we're taking that into account and trying to do everything we can to make that journey a little bit easier.